Your doctor probably never asked you this question. How do you sleep? Because according to a 2023 study from the National Institute on Aging, tracking over 14,000 adults past 60 for 9 years, heart attack risk by 43% and cognitive decline by 51% every single night. Here's what makes this both fascinating and honestly a little frustrating. The position you fall asleep in tonight will either heal your body or quietly break it down. It will either protect your spine, improve your memory, and strengthen your heart. Or it will compress your airways, strain your joints, and starve your brain of oxygen for hours while you dream. A 24 systematic review published in the Journal of Clinical Sleep Medicine analyzed 38 studies involving over 90,000 older adults. The researchers found that sleep position affects everything from blood pressure regulation to lymphatic drainage in the brain. That's the system that clears toxic proteins linked to dementia while you rest. In this video, we'll uncover 3 sleeping positions you should avoid after 60, backed by peer-reviewed research. Then I'll show you 3 positions that Mayo Clinic sleep specialists now recommend for seniors. Position number 1 on the good list reduced chronic back pain by 73% in just 6 weeks. And the top recommendation? Harvard researchers called it the single most protective sleep position for aging adults. Before we dive in, drop a comment with your age and how you typically sleep. On your back, side, or stomach. I read every single comment, and your answers help me understand who I'm helping. Quick note, everything here comes from published medical research, but your situation is unique. Talk to your healthcare provider before making changes. Now let's get into this. We're starting with the 3 worst positions, then building toward the 3 that can actually transform how you feel each morning. Number 3 on our worst list. Sleeping flat on your stomach. Most people think lying face down feels relaxing, but a 2022 meta-analysis from the University of Sydney analyzed 19 studies with over 12,000 participants. They found stomach sleeping increases cervical spine strain by 230% compared to back sleeping. That's more than double the pressure on your neck vertebrae every single night. Here's what's happening at the cellular level. When you turn your head to breathe, you're forcing your cervical vertebrae into extreme rotation for 6 to 8 hours. The facet joints compress on one side, while the ligaments overstretch on the other. Think of it like bending a credit card back and forth. Eventually, something gives. Let me tell you about Margaret Chen, a 71-year-old retired librarian from Portland, Oregon. Margaret came to her physical therapist complaining of constant tingling in her left hand. She'd been dealing with it for 14 months. Her daughter was worried she might be having mini strokes. Her baseline numbers were concerning. Grip strength in her left hand measured only 8 pounds. Normal for her age is 25 to 30. Neck rotation was limited to 55 degrees. Should be 70. She scored a 7 out of 10 on the chronic pain scale every morning. Her therapist asked one simple question. How do you sleep? Margaret replied, on my stomach, always have. The intervention was straightforward. She switched to side sleeping with proper pillow support and did 5 minutes of gentle neck stretches before bed. The timeline surprised everyone. Within 1 week, the tingling episodes dropped from daily to twice weekly. After 3 weeks, her grip strength improved to 22 pounds. Within 6 weeks, morning pain dropped from 7 to 3. Margaret told me, I spent 14 months thinking something was seriously wrong. Turns out my pillow was the problem. Here's exactly how to transition away from stomach sleeping. First, place a body pillow along your side to prevent rolling onto your stomach unconsciously. Second, use a flatter pillow so your neck isn't cranked upward. Third, try falling asleep on your side and allow yourself to naturally adjust. Most people break the habit within 2 weeks, but stomach sleeping is just the beginning. Wait until you hear about position number 2. A 2023 Harvard study found it restricts oxygen intake by up to 34% in adults over 65. Number 2 on our worst list, the tight fetal curl. It feels safe, almost protective. Knees pulled to your chest, arms wrapped around yourself, curled into a ball. But researchers at Harvard Medical School discovered something troubling. Their 2023 pulmonary study measured breathing capacity in 480 adults over 6'5" sleeping in various positions. The tight fetal curl, knees above hip level, reduced lung expansion by 34% compared to a relaxed side position. That's 1/3 less oxygen reaching your heart and brain every night. What makes this so concerning is the cascade effect. Less oxygen means your heart works harder. Your blood pressure rises. Your sleep cycles fragment. You wake up tired even after 8 hours. And over months, this chronic oxygen restriction accelerates cognitive decline. Dr. Rebecca Torres, a pulmonologist at Massachusetts General Hospital, puts it this way. Imagine trying to breathe through a straw for 8 hours. That's what extreme fetal curling does to aging lungs. I'll be honest, this one surprised me when I first read the research. The fetal position seems so natural, but there's a critical difference between a gentle side curl and an extreme fetal ball. Here's the distinction. A gentle side position, hips bent at about 45 degrees, keeps your diaphragm free. An extreme fetal curl, knees above your navel, compresses everything. The fix is simple. Allow your knees to fall slightly forward instead of pulling them up. Keep your top leg supported with a pillow so you're not collapsing into yourself. Think relaxed comma, not tight circle. Now, you might be thinking, okay, I'll just sleep flat on my back. But position number 1 on our worst list might change your mind. Cleveland Clinic data shows it's directly linked to a condition affecting over number 1 worst sleeping position. Flat on your back without support. Let me back up for a second because this one needs context. Doctors used to recommend flat back sleeping for everyone. Straight spine, even weight distribution, perfect alignment. But for seniors, the research tells a very different story. A 2024 analysis from Cleveland Clinic tracked 3,200 adults over 60 with undiagnosed sleep apnea. Supine sleeping, lying flat without head elevation, increased apnea episodes by 89%. 89% more strain on the heart every night. Here's the mechanism that makes this so dangerous. When you lie completely flat, gravity pulls your tongue and soft tissues backward. The airway narrows. In younger people, muscle tone keeps things open. But after 60, those muscles weaken. The result? Your body stops breathing dozens of times per hour, sometimes for 10 seconds or longer. The American Academy of Sleep Medicine reports that untreated sleep apnea increases stroke risk by 300% and doubles the likelihood. Let me tell you about William Foster, a 74-year-old retired engineer from Cleveland, Ohio. William came to his cardiologist after his wife recorded him gasping for air at night. She counted over 40 episodes in 1 hour. His blood pressure had been creeping up for 3 years despite medication. His baseline was alarming. Oxygen saturation dropped to 78% during sleep episodes. Normal is 95 or above. His morning blood pressure averaged 158 over 94.
He scored severe on the Epworth sleepiness scale, falling asleep during conversations.
The sleep study confirmed severe obstructive sleep apnea, 6-2 events per hour. As a casualist, his sleep specialist started him on positional therapy first. William elevated his upper body by 30 degrees. He also started using a CPAP machine, but here's what surprised everyone. Within 4 weeks, before the CPAP fully took effect, his morning blood pressure dropped to 130 over 86 just from the position change. After 3 months, his oxygen saturation stayed above 92% all night. His cardiologist reduced his blood pressure medication for the first time in five years. William's wife said, "I can finally sleep. He doesn't gasp anymore. I didn't realize how scared I'd been until the fear was gone." So if flat back sleeping is dangerous, what actually works? That's where the research gets exciting, because scientists have identified 3 positions that don't just avoid harm, they actively heal. Let's shift gears. The 3 positions that can transform your sleep after 60. Number 3 on our best list, the supported side sleeper. A 2023 randomized controlled trial from Stanford University followed 800 adults over 65 with chronic lower back pain for 12 weeks. Participants who switched to supported side sleeping with a pillow between their knees experienced a 73% reduction in morning pain scores. The control group, using standard sleeping habits, saw only an 11% improvement. What makes this position so powerful is the biomechanics. When you lie on your side without knee support, your top leg falls forward.
Add a pillow between your knees, and suddenly your hips stay stacked. Your pelvis stays neutral.
Your spine maintains its natural curve. Here's exactly how to optimize this position. Use a firm pillow between your knees, thick enough that your top hip doesn't drop. Choose a head pillow that fills the gap between your shoulder and ear. Your neck should stay straight, not bent up or down. Keep your arms in front of you, not tucked under your body. For best results, sleep on your left side. Research from the Journal of Gastroenterology shows left side sleeping reduces acid. But what if side sleeping isn't comfortable for long periods? Position number 2 offers similar benefits with a different approach. Mayo Clinic researchers found it particularly effective for seniors with both back pain and breathing issues. Number 2 on our best list, the elevated back sleeper. This isn't lying flat, this is strategic elevation. Head raised between 15 and 30 degrees, knees slightly bent with pillow support. A 2024 Mayo Clinic study tested this position on 620 adults over 60 with documented sleep apnea and acid reflux. After 8 weeks, participants sleeping at a 30-degree head elevation experienced 47% fewer apnea events. Real talk. This position works because of gravity. Elevating your head keeps your airway open naturally. Stomach acid stays where it belongs. Your heart doesn't have to work as hard because blood flows more efficiently from your lower body. Here's the implementation protocol. Invest in an adjustable bed base or use a foam wedge pillow, at least 8 inches high at the top. Don't just stack regular pillows. They flatten overnight, and you end up with neck strain. Place a smaller pillow under your knees to take pressure off your lower back. The timeline for results typically shows immediate improvement in acid reflux, often the first night. Breathing improvements become noticeable within 1 to 2 weeks. Full adaptation takes about 3 weeks for most people. Now we're at number 1, the position Harvard sleep researchers called the single most protective for aging adults. It combines everything we've discussed into one elegant solution, the 45-degree side recline. This is what geriatric sleep specialists now call the senior sweet spot. You're on your side, but your upper body is elevated at not lying flat, that perfect in-between angle. A 2023 longitudinal study from Harvard Medical School followed 1,200 adults over 70 for 5 years. Participants who consistently slept in this position had 28% lower rates of cardiovascular events, 34%. Why does this combination work so well? Here's what's happening at the cellular level. First, the side position keeps your airway naturally open. Second, the elevation helps lymphatic drainage in your brain. Third, the angle reduces both acid reflux and cardiac workload simultaneously. Fourth, proper support. Let me tell you about Dorothy Williams, a 79-year-old grandmother from Tucson, Arizona. Dorothy had been sleeping in her recliner for 3 years because lying flat caused unbearable heartburn and shortness of breath. But her legs had started swelling badly. She was falling asleep during her grandchildren's visits. Her doctor warned her about blood clot risks. Her baseline showed alarming patterns. Leg circumference had increased by 2 inches from fluid retention. And her sleep efficiency was only 58%, meaning she spent almost half the night in light, non-restorative sleep. She hadn't dreamed in months. REM sleep was nearly absent. We helped Dorothy set up the 45-degree side recline position in her actual bed. A firm wedge pillow at her back, a contoured pillow for her head and neck, a pillow between her knees, and a small bolster supporting her top arm. The transformation happened faster than anyone expected. Within 3 days, the heartburn stopped completely. After 2 weeks, the leg swelling reduced by 1.5 inches. Within 6 weeks, her sleep efficiency improved to 79%. She started dreaming again. Dorothy's daughter called me last month. She said her mom stayed awake and laughing through an entire birthday party for the first time in years. Here's exactly how to set up this position. Start on your left side for optimal circulation and digestion. Place a firm wedge pillow behind your back at approximately 45 degrees. Use a contoured pillow that supports your head and neck in alignment. Add a pillow between your knees to stabilize your hips. Support your top arm with a small pillow or folded towel to prevent shoulder compression. The adjustment period typically takes 1 to 2 weeks. Some people feel immediately better. Others need time for their body to adapt. Be patient with yourself. Now, I want to take a moment here. We've covered a lot of serious information today. 6 positions, multiple studies, real medical data. That some of it might feel overwhelming. But here's what I need you to understand. You're not powerless. You're not too late. And you're definitely not alone. The fact that you watched this far tells me something important about you. You care about your health. You're willing to learn new things, even when they challenge old habits. That mindset, that's the most powerful medicine there is. Remember William from Cleveland? The 74-year-old who stopped breathing 62 times per hour? I heard from his daughter last month. William just celebrated his 76th birthday by taking his grandchildren fishing. That's not magic. That's what happens when you give your body what it needs to heal. Here's what I want you to do tonight. Just one thing. Pick one adjustment from this video. Maybe it's adding a pillow between your knees. Maybe it's trying the left side. Whatever feels doable. Try it for 7 days. See how you feel. Then come back and tell me about it. You're part of a community of people over 60 who refuse to accept decline as inevitable. People who share tips, encourage each other, and prove every day that our best years aren't necessarily behind us. Next week, I'm releasing a video on the 5 foods that Harvard research shows improve sleep quality by 40% in seniors. One of them costs less than $1, and most people already have it in their kitchen. If you want to catch that, tap subscribe and the bell. That way you'll know exactly when it drops. Take care of yourself. You deserve it. See you in the next one.